You're listening to a Raconteur Studios podcast.
Welcome back to the After Hour Skin Clinic, the podcast where we dig deeper into all things skin and health, the real conversations that often happen behind closed clinic doors. I'm one half of your hosting duo, Dr. Ellie Rashid, consultant dermatologist, and in today's episode, we're talking vulvas and vulval health. What's normal, what's not, and why the misconceptions and bad practices surrounding the vulva just need to leave the room. Today, I'm joined by the brilliant Dr. Simi Adedeji. She's a GP partner, very successful YouTube content creator. She's a women's health expert, having achieved a diploma in sexual and reproductive health. She's also a skin expert and undertaken a master's degree in aesthetic medicine and a diploma in dermatology. And she really breaks things down in this most beautifully accessible way, breaking taboos in women's health. Simi, so gorgeous to have you. Thank you so much for joining.
Yeah, it's great to be here.
So we want to talk all things vulval health, and also we see so much vulval dermatology. And your channel is perfect because it has so much information about vulval health, so much information about skin health, and you really intertwine sort of women's health with dermatology all into one very accessible YouTube channel, in addition to all of your other platforms. So I guess first things first, shall we start by going through some of the real misconceptions when we're thinking about vulval health? What are the most bizarre misconceptions that you think people hold about their vulvas?
There was a time when I was doing aesthetic medicine when women would talk about having a pink vulva. There was this thing where everyone wanted to have a pink vulva. And it was like, if you have a darker skin tone, your vulva is not going to be pink. It's going to be the same color as you. And I think this comes from, I guess, like social pressure and from, I guess it's society, isn't it? Just putting that pressure on women and having that conversation with women to say, look, your vulva is not going to be pink if you are brown. It's okay.
You've got melanin rich
That's
skin.
it. If you're as dark as me, that's it. Your vulva is going to be the same color as the skin, or actually slightly darker, because I think there's an increased number of melanocytes, or density, should I say, of melanocytes in the genital region. So you often find that your vulva is darker than your usual skin color, and it can get darker in pregnancy. It can get darker with using hormonal contraception. So this kind of pressure that you have to have a pink vulva, and women will say, yeah, but I think that I should get it lightened because, you know, it's too dark. And it kind of makes you wonder, doesn't it? Who are you doing that for? Because unless you're a contortionist, you actually can't see your vulva very well.
I was once at a swimming pool and I was just getting changed and it was just in the communal area, and there was this little boy and he was just completely staring at me. And so I didn't think much of it. But then the mum came over and apologized and said, oh, has never seen your colour skin, and you know, my areola are darker and my vulva is darker, and hadn't seen those colours before. He was a white boy with a white mum, and just, yeah, it was like a point of interest because he hadn't ever seen it before.
Yeah, and it's important, isn't it? This is part of knowing you're normal, isn't it, as well? So that you're not kind of medicalising something that's completely normal, like with this dark vulva. It's a contrast as well on darker skin is often increased, isn't it? So on lighter skin, you might not notice that your vulva is more pigmented because everything is light. But on darker skin tone, then that's when you really start noticing the difference in the contrast. So that's why
actually in dermatology there's been a massive drive to try and increase the number of photographs of different skin tones, because all of our textbooks, everything online pretty much is all on white skin. And there's a huge drive just so that we can understand, and people that are coming through and learning and training can see images of different skin conditions on different skin tones.
Yeah, I agree. And it's something that I really advocate for on my channel. I'll show the different skin conditions on different skin tones. It's so important to be able to see yourself. Actually, for us as well as, you know, doctors, healthcare professionals, the first time that I ever saw a scarlet fever rash on dark skin, I completely missed it because I'd only ever seen it on lighter skin. And you don't get that kind of erythema and redness. You don't really see that as well in darker skin tone. And even then, sometimes it means that a condition might be not just misdiagnosed, but also like the severity might be missed. Because if you're not seeing something looking really red, you might think, oh, actually, it's not that bad on darker skin, because you're missing that visual clue that you're used to seeing. So it's so, so important.
Completely. And a condition that affects the vulva, like vulval eczema, often can cause thickening of the skin. And that thickening means that it's all lichenified and thickened. But sometimes people just look and dismiss it as, oh, it's just darker because, they've got pigmented skin, so their vulval skin looks darker. But actually, if you take time to examine the skin, you'd realize that it's all very thickened up. And it's important not to miss things in darker skin tone. So yeah, also important.
Yeah, I agree. Same with psoriasis, actually, because, it's often described as that salmon pink with the silver scales. And in darker skin tone, you often don't see a salmon pink with silver scales. You might see kind of a darker pigmentation or a purplish. And if it's on the vulva, because psoriasis is actually common on the genitals, then it looks completely different. It can actually be shiny and look a little bit moist because the skin there is under occlusion and it's kind of just a more moist area. So it looks completely different. I came across something actually on TikTok when there were women asking maybe their partners about, what do you think about vulval health? And one of the bizarre things that came up, or at least it's bizarre from my point of view, was that people were saying that they were surprised that you can pee if you have a tampon in. Have you seen it as well?
I've seen it as well. And it was absolutely shocking that people thought that a tampon had to be removed before urinating.
I guess because being from a medical background, being a doctor, didn't really think of it in that way, that people thought that urine and period come out of the same hole.
So should we start with the anatomy? So for those that are listening, give a quick synopsis of vulval and genital anatomy and how people might get it wrong.
Okay, so I guess the first thing to say is that when we talk about the vulva, it's like all of your external genitalia. So people often use that kind of interchangeably. They'll use the word vagina and vulva interchangeably. So the vulva is all of the external genitalia. So that includes like the mons pubis, which is like the mound of fat in front of the pubic bone. And then also the labia majora, which is the outer lips. And then the labia minora, which are the inner lips. And then you've got the clitoris, and you've also got the clitoral hood, which kind of protects the clitoris. And then you have the perineum, which is the area between the vagina and the anus. And then, of course, you've also got your vagina, which is separate. So what you can see of the vagina is the entrance, because it's actually a tunnel, if you like a muscular tunnel. And you can see the entrance of the vagina in the vulva or on the vulva. And then finally, you've also got the urethra, which is the pee hole. So that's what we were just talking about just a second ago, about how that's separate from the vagina. Do you know what? Actually, I've just reminded myself that, when you first on the wards after being at medical school, and I had been asked to catheterize this patient. So previously, you practice on the dummies and you know exactly where everything is. And I'd also previously, after having had consent, also practiced catheterizing a patient that was having surgery. So was, asleep. So I think it was literally my first 2 or 3 days of being a junior doctor on the wards. And I was asked to go and catheterize this patient. And I was all ready, had everything on, all my equipment was set out. And one of the nurses said, oh, do you want to come with me? And the nurses are your best friends. They literally help you through.
Saviors.
They really are, honestly. So she said, do you want me to come with you? And I said, yeah. So she came with me. We got everything set up. So I had catheterized this patient, this woman. And sometimes you're kind of just waiting and then you're like, there it is. The urine's flowing out of the back. So I'm waiting. And she taps me and she goes, Simi, it's in the vagina. And I was just like, oh my goodness. So even with healthcare professionals, even with doctors, sometimes, we can't find it properly, because actually the urethra, you won't necessarily notice it because sometimes it's actually not that visible. It's literally like a little dimple. Even we get it mixed up sometimes.
I have done exactly the same thing.
Yeah.
I've catheterized the vagina. My experience was when I started dermatology as a first year registrar, I was at Lewisham Hospital and I was doing a paediatric clinic, and I I didn't grow up with like many children around, and so I wasn't seeing many children and not really having a reference point for what things should look like what normal looks like. And I had to call my consultant in to come and just make sure that what I was, because I couldn't see any abnormality. And I just wanted to make sure that I wasn't missing something. Because I guess that's the key. The first things first, you need to really know what normal looks like. And I always advise women, just get a mirror out, look at your own anatomy, make sure that you feel comfortable with the way things sort of look, you know where things are. And then if there to be a particular condition that affects the vulval skin, you then know that things look different to how they used to look before. So I do think it's really important just for people to understand how things look and what normal is for them. And there's so much variation between normal anatomy. So you just want to remind yourself what things look like for you. So then if there are any symptoms of itching, bleeding, anything like that, you just can understand how things are looking different.
That's so important. I think so many women don't feel comfortable doing that. So just getting a mirror, having a look, familiarizing ourselves with what it looks like you said, because that's the only way that you're going to know when something is kind of out of sync, if you want. It's so important that knowing your normal is so important because it's what's normal for you.
Completely.
Do you know what I mean? If your vulva starts looking slightly different to what your baseline is, then you want to be speaking to your doctor about it and saying, look, I've noticed this. And this is also where it's then important to actually know the correct terminology so that you're on the same page. And I think having that language, because we're talking about the anatomy, it's really just about knowing your normal and also having the correct language so that you can have these kinds of discussions.
Completely. What are your thoughts about the way people talk about their vulva or the names that they might give their vulva? I know that there's this big drive at the moment to sort of teach children from a young age anatomically correct terminology, like refer to a vulva as a vulva, not like as a foo-foo or a mimi or, whatever the words might be. My generation growing up, it was very normal to like have a word that wasn't vulva to describe the vulva. But similarly for boys, there was a different word to describe a penis. What are your feelings about that? Do you think that's a positive thing? Or do you think, actually let people call it a foo-foo or a fifi or whatever they want to call it if they want to?
So I was the same. So my generation, it's very common to kind of have like a pet name that you would call your vulva, whether it was like, I don't know, Cookie, whatever it was.
Yeah.
And I guess it comes from the idea of trying to protect the child's innocence and kind of not sexualize things early on. But I think it's really actually important to allow children to use the correct anatomical terms. So first of all, the name vulva, there's no shame in it. It shouldn't be taboo to use that name. It shouldn't be something that's shameful or that children feel, embarrassed to talk about. And I think normalizing the use of the word vulva is really important early on because it teaches children that actually your body is not something that you need to be ashamed about. It's not something that you need to feel embarrassed about. And from a safeguarding point of view as well, it's actually really important because, there have been studies that show that in terms of abuse, for example, abusers will often exploit the confusion that children have around their bodies and about the body parts and what they call them in order to kind of keep them silent. Do you know what I mean? And a child that's able to communicate using the correct words is able to make themselves heard and believed because they're communicating in the same way that the grown-up would be, I guess. So it's really, really important. I've got 2 daughters, so I've taught them from a very early age the correct anatomical term. So they both say vulva and neither of them are embarrassed. They kind of just use it in the same way as they would be like my elbow or, my nose. And the other day, actually, we have a little dog and we'd taken our dog to the room and she'd come back. She was all like perfumed or whatever it is that they put on them. She was licking herself and my daughter goes, "Mummy, why is she licking her vulva?"
Brilliant. Well done.
I was like, oh, I'm proud of her that she was able to use the word and not be embarrassed about it, So I had to explain. I think it's a bit irritated because she's just had her groom.
Oh, bless her. So next, let's talk about hygiene and different products that are available that are very much marketed towards cleansing the vulval skin. How do you think one should wash their vulva?
So I guess the first thing that I would say is like, it's not prescriptive. It's not like you have to wash your vulva in this way. And if you're not doing it that way, then you're not doing it correctly. Do you know what I mean? Women have been washing our vulvas for millennia. And it's more about thinking, what are the kind of principles that you can use to maintain good vulval health? That's the main thing that I would say.
I love that.
So I guess it's common sense things, for example, using lukewarm water. You can use your hand. And then in terms of choosing a product, I think this is where maybe sometimes confusion comes, or disagreement in some cases, because there are different options of what you can do. So I would say that you should use lukewarm water and a gentle cleanser. So you can choose whatever cleanser works best for you. So I tend to say avoid soap, because soap is quite alkaline and it can be drying. So I lean more towards products that are combination products. So for example, if you've got soaps that have synthetic detergents mixed in, so these are the ones that you might see called beauty bars and things like that, or completely synthetic detergents, because they're so much more gentle on the skin. And then if that's irritating for some people or dry for some people, then you can move towards the emollients, because you can use emollients as soap substitutes. And I don't think that many people know that, because they're like, oh, that sounds a bit strange. Like, why would I use a cream or a moisturizer or an ointment as an emollient? And it's actually a really, really useful thing to do for, women that have problems with dry vulvas or vulvas that are just irritated. It can feel strange at first, can't it? Because they don't lather like soap like you're used to. So you kind of feel a bit strange that you're putting this moisturizer on or emollient and then washing it off with water. And then you can also reapply it again if you need. So that's what I advise.
Yeah, I say exactly the same. And I say it takes a little bit of getting used to if things aren't frothing up, because you're so used to things frothing up. And that's how you associate that with feeling cleansed. But actually, I love an emollient cleanser. So just to use an emollient just as your cleanser, just think of it as like an oil-based cleanser. That's how I think of it. It just doesn't dry things out. My other advice that I normally give people is just to really think about the external vulval skin. So there's absolutely nothing that you should be inserting in any way. Your vagina doesn't need to be cleansed in any way. You shouldn't be inserting any products into the vaginal entrance, like just to keep it all external and on the vulval skin.
Yeah. And I think it's also really important to pay attention to all of the folds. So all of the areas, all the nooks and crannies, if you like. Because sometimes when I say to patients, oh, don't put anything inside the vagina, they kind of think that I mean, don't wash the inner lips. So there seems to be a little bit of confusion. So they'll go, oh, right, okay, so I'm only supposed to wash the outside, like where the hair is and where the pubic area is. And it's like, yes, you are. But you can also wash, the inner lips as well. You can wash the labia, but don't put anything inside the vagina. The other thing I was going to say is just to mention about douching.
Yes, yes.
Culturally, that's actually quite common in some cultures, isn't it? Of
Totally.
Kind of washing the inside of the vagina out with some solution or some liquid, especially after a period, because it makes people feel clean. And there's the belief that you need to clean everything out because it's dirty. And it's just trying to educate people that the vagina is self-cleaning. It's got this really delicate ecosystem of bacteria, and the pH is being maintained at a particular level. And when you start introducing things, you can actually disturb that balance, and then you can get symptoms because of that. So I think that's the other thing that's really important to highlight.
That brings us nicely onto some common conditions that can affect our vulva. So shall we start with BV? So first of all, what is BV and what sort of things can women try to do to reduce their chances of getting BV and how to manage it?
Okay, so BV is bacterial vaginosis, and it's basically a type of infection of the vagina. When I say infection, it's more of an imbalance of the bacterial microbiome that's there. So you usually have a high population of a type of bacteria called lactobacilli, and this helps to keep the vaginal environment acidic and that nice pH balance that we often hear about, because that keeps the vagina healthy. But sometimes, and that balance is off. So you get fewer lactobacilli and you get an overgrowth of other types of bacteria. I remember when I was a medical student, we used to think it was one type of bacteria in particular that caused BV, but actually we're now thinking that it's multiple species and not just one. What then happens is that you tend to get a vaginal discharge, and there's a change in the color of the discharge, there's a change in the consistency, and also a change in the smell, which is often the thing that women will notice first of all. So they'll say, oh, actually, they've noticed that the vaginal discharge is grayish or whitish, and it's become really thin and watery. And also it has this kind of strong fishy odor, which women tend to notice more after sex or after they've had a shower. And, it's like with all of these things, it's important to know the signs, because what you want to do is to be able to present early, because all of these conditions are treatable. Bacterial vaginosis is super common. It's so common. And it's definitely treatable. It can be a nuisance to treat because it could come back again and again, but it's definitely treatable. And sometimes it can be confused with other types of infections that can affect the vulva. So those are the symptoms of bacterial vaginosis. And I think it's important that we're aware of these common conditions as well.
Thinking about discharge, I think women just need to talk about discharge more often, because we've got no reference point of what, is it normal to develop quite a thick sort of, egg whitish discharge at certain parts of our cycle? I think it's important, one, for us to have a conscious thought about our discharge and how it changes throughout our cycle. And secondly, just to talk about it openly. We're all having discharge, and it's important just to know sort of how other people are coping with it. And I think because bacterial vaginosis is associated with this sort of odor, people sort of won't openly talk about it, particularly if they think they're suffering with it. They'll try lots of solutions at home. The commonest thing that happens is someone will notice a smelly discharge, a change in their discharge, and then they go to their nearest pharmacy and they'll buy every product on the shelf that is marketed for the vulva and for pH balancing and femme fresh this and fresh that, and then make the whole problem worse by trying to really give it a good cleanse, because they think, oh, it's because things aren't cleansed properly. That's why it doesn't smell like it normally does. There's a bad smell associated with it. Makes the whole problem worse. And actually, as you say, they could just be seen, and you could even have a conversation with a pharmacist about it. And there are some over-the-counter things that you can buy to help to improve things. And then, of course, to see your GP to try and help improve things as well. So I do think it's really good for people just to talk about it.
Definitely. And I agree with you. I think there's this tendency to think, oh, there's a smell, and not necessarily consider what the condition is as a whole and think, okay, I need to mask the smell. So it's often with the fragrance products, isn't it, trying to mask the smell. And actually, one of the causes of bacterial vaginosis can be upsetting that balance because of using fragrance products. So you could actually inadvertently be making the problem worse without realizing it.
And on the same spectrum of imbalance, shall we talk about thrush and sort of what the common symptoms of thrush are and how we can manage that?
Yeah, sure. So we're talking again about a type of vaginal infection, this time a yeast infection, so it's commonly known as thrush. And I think the thing I want to say about thrush is that you can get vaginal symptoms and then you can also get the vulval symptoms. So with the vulva, the infection could kind of irritate the skin of the vulva. So you might notice that the labia become a bit swollen. They might become quite red, sore. Sometimes they can get cracks on them, so we call fissures. And it can make going to the toilet, like to pass urine, really uncomfortable, right? Because as soon as the urine touches that skin, it's like, it burns, it stings, it's uncomfortable. Sex can be uncomfortable. And I think when people think about thrush, they mainly think about the vaginal symptoms. So, there's discharge, and the discharge is white usually, and it can be quite creamy, or it can also be quite thick and clotted. And it's been compared to cottage cheese. Sorry for anyone who enjoys cottage cheese.
Protein, think of the protein.
That's it. So, and it really does look like that. So you've got those symptoms, which are the vaginal symptoms, and then you've also got the vulval symptoms, which I've just described, and the itch. Let's not forget about the itch, which can be, it can be incredibly uncomfortable and a source of social embarrassment, shall I say, for women. I actually made a video about this just because, like you say, I feel like there isn't enough said about discharge and vaginal infections and just how common It is. And I think if we talked about it more, we would realise almost everybody has experienced something like this at one point or another, during their lives. And in that video, I talk about the itch and the fact that it's so uncomfortable and it's kind of not seen as being socially acceptable to be scratching your vulva in public. And it's important to know that there is help out there. A lot of these things that we treat thrush with are available over the counter. And actually, if you've tried the over the counter medication and they don't work, you can also go and see your doctor as well.
God, thrush is such an uncomfortable thing. I remember certain antibiotics can really upset that balance and can lead to thrush. And I find one of the most common culprits, because we prescribe a lot of penicillin-based antibiotics for different dermatological conditions. And I always warn people that thrush can be a potential outcome of being on these antibiotics, because it just changes the flora, the bugs that all live in harmony in the vagina can upset that balance. You get this overgrowth of yeast, and then that's when you present with thrush. And I tell people this, and yet when I had a course of augmentin or Kermoxclav, which is a big culprit for thrush, I didn't immediately realize that I had thrush. I remember just sort of thinking, what is that swelling? And that, gosh, that it was really painful. It just felt painful and swollen. And then it was only sort of a day later that I thought, of course, it's like the thing that I warn everyone about, the thing that I've got. And all of these things, as we say, pretty much every single woman would have been through this, BV, thrush. And I guess the other common thing that many women will struggle with is recurrent urinary tract infections, or just getting urinary tract infections. So what would make someone more at risk of developing a UTI or urinary tract infection? And how would we ordinarily manage that?
So urinary tract infections are super common. So when we talk about them, we're usually talking about cystitis, which is kind of inflammation of the bladder. And again, it's one of those ones that most women will have experienced a UTI exactly at some point in our lives. And it occurs for different reasons. Sometimes you can't find a reason. Sometimes it can occur shortly kind of after someone becomes sexually active. And we think that's because just from having sex, there is an increased chance of kind of shifting or moving the bacteria that normally lives on the skin, around the perineum, into the urethra, and then into the bladder from there, causing the symptoms of the UTI. So you get the burning when you pass urine, you get the fact that you want to dash to the toilet. So the frequency, you just want to dash to the toilet. You can't wait. You feel like you can't hold on to your pee for that long. And then you also get the vulval symptoms. So I know that we're talking about the urinary tract, but the lower part of the urinary tract opens up into the vulva, like we talked about the urethra. And when that urethra is inflamed, you can get the soreness and you get the burning when you're passing urine as well.
And the treatment for it is often antibiotics, and antibiotics can work really well.
This is it.
But then it might potentially put you more at risk of other vulval conditions. So you might have antibiotics treat your urinary tract infection, and that may potentially give you a thrush type of infection. So sometimes the antibiotics that we would ordinarily use don't often cause thrush, but sometimes you are given antibiotics that can put you more at risk of developing thrush. So yeah, it's just important to see someone. So one, you've got the correct diagnosis because the symptoms can all be relatively similar, and then sort of have it appropriately managed.
That's right. And the other time I think that women sometimes experience increased urinary tract infections is during pregnancy. Because when you're pregnant, You've sort of got that, you're immunosuppressed, aren't you? So you're kind of more prone to getting these UTIs and things like that. And there's so many hormonal changes are going on. So that's another kind of time when women are like, oh, something else to add to the list. And the other thing I wanted to say is that sometimes UTIs and thrush are actually confused because they can have overlap of symptoms. So there'll be times when a woman come up to me and say, oh, in my clinic, they'll say, oh, I've got this burning and stinging and I've tried everything, it's not going and it's a little bit itchy. And then you're thinking to yourself, oh, right, okay, it could be a UTI, or it also could be thrush, because you don't always have that creamy white cottage cheese discharge with thrush. So there is an overlap of symptoms. So I always say, if you are trying, over-the-counter medication and it's not getting better, come and see us, because we need to be thinking about other diagnoses as well.
One of the things that I've been talking about recently is vulval itch is such a common symptom that someone will present to their GP or healthcare provider with. And when someone has vulval itch, one of the questions that I ask them is this itch waking you up from sleep? Because there are a few dermatological conditions where the itch is completely intractable and it will wake you up. And the two vulval conditions that I think not many people may have heard of are lichen sclerosis and lichen planus. And both of these conditions can affect the vulva. To think about lichen sclerosis initially. So this is an inflammatory vulval condition, can affect children as well as adults. In children, it can sometimes present as constipation, and in adults, it usually presents with this vulval itching. But the reason that it's important is because if it is diagnosed, it can then be treated. And one of the outcomes of this inflammatory vulval condition is that you can get this architectural change of the vulva. So coming back to the very beginning of us having this conversation, it's so important for women to know what their vulva looks like, what the labia looks like, what the clitoris looks like, the clitoral hood just slightly overlying it, the labia minora look like. Because one of the things that can happen if someone has lichen sclerosis that is left to progress without being adequately managed is you can get some resorption and scarring affecting the vulva, where you can lose the labia minora, you can get resorption of the labia majora, you can get loss of the clitoral hood, and you get these white sort of patches and red patches, and sometimes these bruise-like areas on the vulva called ecchymoses. And so it's really important if someone has got itch as a symptom to see their GP. It could be something as common as thrush or a UTI or BV, but then you also need to think about some of these other inflammatory vulval conditions where you need to treat them. Otherwise, it's a scarring and progressive condition. And the treatment is usually potent topical steroids. So just always have that in my mind of if someone's describing that, I will always examine the vulva just to make sure that there's none of that architectural change and I'm not making a completely different diagnosis, which will have to be managed in a completely different way.
So I completely agree with that. And I think lichen sclerosis is one of those conditions that deserves more recognition and to be highlighted more because it's actually quite common, isn't it? It's not it's not that rare. And like you say, the itch. And I think there's a tendency, at least in my experience, when I've seen women and they've got vulval itch, they automatically always assume that they have thrush.
Always.
It's like itchy vulva equals thrush. And actually, there are a whole host of other conditions that cause vulval itch. And a few months ago, I had a patient who, just like you said, was battling with vulval itch, thinking that she had thrush, used over-the-counter medication, used the external creams, the internal cream, the whole lot. And, you know, she finally came to see me and she'd done some research actually. And she was like, oh, I really want the tablet. Like, can you give me a tablet for it? I think I can't clear it any other way. So I said, okay, why don't we just examine you and have a look? And actually what I found were these patches, so really pale patches on the vulva, especially on the labia minora, so the inner lips. And it also has that kind of really thin, like crinkly look about it, the surface of it, you know, where it's a little bit thin. So the skin was quite crinkly and there was already some loss of architecture, like you say. So on one side, the minora had started to kind of thin and almost start merging with the labia majora, with the outer lip. So yeah, you can actually, you know, lose some of that normal architecture and that's some of that normal anatomy if it's not treated. So it's so important. Just because the vulva is itchy doesn't mean it's thrush. There are so many other things as well.
Shall we talk a little bit about sort of how the menopause can change people's vulvas and some of the vulval symptoms that go along when women enter the menopause? One of the things that I usually tell women is the pH of the vulva can change as we enter the menopause. The menopause is obviously just this one day in a woman's life, and it's sort of 12 months after they've stopped having periods. And so that one day is called the menopause, then it's premenopause, postmenopause, and that whole time around it is perimenopause. One of the things that can happen particularly in the perimenopause and postmenopause period, is that the pH of the vulva changes. So the pH is normally quite acidic, can sometimes become more alkaline, so the pH can increase. And with that pH change, sometimes the chance of developing some of these conditions can increase as well. So you might notice that women will say that they're getting more UTIs, or they're getting more thrush, or they're getting more BV. Is there anything that you normally advise for women that are having more genital symptoms, genitourinary symptoms, who have gone through menopause?
Yeah, I mean, it's exactly what you've said. There are so many changes that are going on, and a lot of these changes are due to the fact that the estrogen levels have now gone down. And, the vulva, the vagina, and kind of the environment in and around that is really highly dependent on estrogen. So sometimes women will notice that everything feels drier. So the skin feels drier, inside the vagina feels drier, making sex uncomfortable. And also with that can come vulval itch as well, with the dryness. So that's also one of the symptoms that postmenopausal women will describe. And there is actually quite a lot that can be done. So, for example, for the dryness that happens or that occurs inside the vagina, there are lots of different topical treatments. So vaginal lubricants, vaginal moisturizers that can be used, topical estrogens to kind of help replace the effects of the estrogen that's been lost inside the vagina, to help keep those tissues kind of soft and supple and, comfortable for life and also for sex as well. And I think that women don't realize that these are options as well, because some women automatically think, oh, menopause, maybe that means I need to have HRT. Maybe, but there are actually other topical treatments as well that can be used to help with the symptoms.
Completely. And I also think it's important for us to talk to women about whether they want to achieve penetrative sex. It might be important to people. And if you're finding sex really uncomfortable because there's less secretions and things aren't as sort of bouncy in that area, things have tend to thinned a little bit in that area and become a bit atrophic. And so sex might be uncomfortable. And there are some really good lubricants. And I know now, I mean, it's a massive industry, but I know that now sort of vulval skin lines are being brought out for like vulval serums and vulval moisturizers and lubricants, and ones that contain CBD and ones that contain all these different ingredients that are meant to be helpful. But I think as long as they're well tolerated and as long as they're not causing any irritation, you're not developing like a reaction to them or a sensitivity to them, I think if they can just help to moisturize the area where it has got more dry, I mean, estrogen preparations can really transform the health of your vulva. It can really reverse some of those features that you're seeing. So it's definitely something I ask patients to. I don't prescribe that. I often ask patients to see their GP when it comes to prescribing of estrogen gels and creams. What are your favorite brands for like some of the lubricants and moisturizers?
I don't know. I wouldn't say that I have favorite brands, because, whenever you give something like this, someone will have a reaction and then you'll be like, oh no, Dr. Simi recommended this. And then I had a reaction. I always say, or I always try to not be prescriptive and just to give kind of principles so that people find their own brands and their own products that they enjoy and that they like. And the other thing that I wanted to mention when you were talking about the lubricants and what to use down there, this is often the stage as well when it's really helpful to use emollients as soap substitutes because of the dryness that you can get around the vulva. Have you got favourite brands?
In clinic, in the vulval dermatology clinic, we've got these little sachets and the brand is Yes.
Oh.
And then they've got Yes OB, which is the oil-based, and Yes WB, the water-based. And yeah, so they're lubricants. So only just because they're in clinic. So we tend to give out these little sachets.
I love the names. They always come out with these really interesting names, aren't they? Yes.
And then the lubricant that I know is popular for intercourse is called Oomph. Similarly, like these great names. Yeah. So Yes and Oomph. And if you want to know more about vulval skin and how it changes during menopause, then Emma and Dr. Ziggy, who's an expert in menopause and women's health, have done a whole episode focused on this. When it comes to things that people sort of should be doing, are there any tips that you give to people about what they shouldn't be doing? And I'm thinking more along the lines of some of these wipes that sometimes people might be inclined to use in the similar sort of way as we were talking about before. They want to get like a thorough cleanse. Do you ever give any advice on the use of sort of cleansing wipes for the vulval skin?
Okay, I'll start with the cleansing wipes.
Yes,
because you've brought that up. So if you ever look at the ingredients list of these cleansing wipes, you'll see that there are so many ingredients in there. And the more ingredients that you have, the more there is a chance that there will be something in there that's going to cause irritation to the vulva. It's not something that I advocate. I don't advocate for cleansing wipes. I know that people can find them convenient. You can just pop them in your bag and, but actually, you might see this a lot in your vulval clinic as well, that once you've taken the history and you've kind of tried to whittle everything down to what's causing the irritation, and then when you actually start to educate patients about, have a look at the ingredients list, there's fragrance, and it's not, sometimes it can be masked, can't it? So the word fragrance is not used. Maybe it's a different word that's used, and they don't recognize that, this can be irritating to the vulva. So for this reason, it's not something that I recommend or advocate. I don't know how you feel about it.
Yeah, so the only sort of wipes I'd recommend if people really wanted to use wipes for whatever reason it might be, maybe they've got a bit of fecal incontinence, maybe, there's a reason why they want to use it in the perianal skin and to wipe with. I normally recommend a water wipe, so just literally, that's the brand, water wipes, and it just has water in it. But I don't like any of the fragranced wipes. Huggies wipes tended to have a preservative ingredient in it that lots of people were having a contact. So this is a direct contact with an ingredient that can cause an eczema type of reaction and get like a contact allergy eczema from the use of certain types of wipes. A really good tip that a vulval dermatologist that I work very closely with, Fiona Lewis, a really good tip that she has is to have some of these vulval emollients, or just emollients, but emollients that you're going to use on your vulva, just to have a pot of it in the toilet. And then just every time you're going to use the toilet, just put a layer on, just to moisturize that area to try and prevent it from getting dry. And it's just a really good way of doing that as often throughout the day as possible. And you can even have these little tubs that we normally give of epiderm ointment, and you can just have that little tub, and then you can just put a layer on just over the vulval skin just to make sure it stays well hydrated and moisturized.
Yeah, that's a really good tip. With the water wipes, I actually was introduced to that when I started having children, because I was looking for something that was going to be, unfragranced, less likely to irritate their bottoms. And that's when I discovered water wipes. So yeah, that's the only one that I know that doesn't have that many ingredients in there. I don't know if there are, I don't know any other wipes that are that way. And also just the other thing that's important is, again, to reiterate, is not to put anything inside the vagina, because it's self-cleansing. If you're going to use the water wipes, you're using it on the external genitalia, so on the vulva, but not inside the vagina.
Simi, thank you so much. I think you do such a fantastic job to make this information really accessible. You have such a lovely manner about you. I just feel completely comfortable talking to you, so I can see why you've done so incredibly well. I encourage everyone to go and check out all your different platforms, particularly YouTube, because you really do bridge this gap between women's health and dermatology and skin health in this beautifully accessible way. So thank you. Thanks so much for joining me.
Thank you so much. And I'm really pleased that you invited me to come on. We often have a chat, but it's been nice to have a chat on here as well.
It's gorgeous. Yeah, I look forward to seeing you very soon. And that's a wrap. If you enjoyed this episode, please share it with someone who might need to hear it. And do give us a follow if you haven't already. It really does help us to reach more people like you. And if you have any questions, please contact us. We always love to hear your questions. Okay, that's bye for now. Take care of yourself and your skin and your vulva. Wear your SPF and see you next time on the After Hours Skin Clinic.
As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.